And now, Yahala with Dr. Abu Shanab, brought to you by Bridgeview Chiropractic.
أهلا وسهلا مستمعينا في حلقة اليوم من برنامج ياهلا مع الدكتور أبو شنب. معكم يولي ريحاني في التقديم وخالد خلفة في الإخراج، وإنتوا عم تسمعونا على 1450 AM على راديو ياهلا فويس. في برنامج اليوم اسمحوا لي أرحب بضيفنا الدكتور رشيد أبو شنب. أهلا وسهلا دكتور.
هلا فيك يوليا.
دكتور، برنامجنا كالعادة بيقدم توعية صحية ومعلومات ضرورية حول كل ما يتعلق بعلاج العظام وآلام الظهر والمفاصل وإصابات الحوادث وغيرها من المواضيع. وبدي أدعو لمستمعينا أنهم يتابعونا على صفحتنا على الفيسبوك، وإحنا بنرحب بأي اقتراح أو أي سؤال متعلق بموضوع البرنامج. دكتور، يعني إذا في أي حدا من مستمعينا بيحب يقترح بموضوع أو يشارك بفكرة، نحن ممكن نتعمق فيها بالحلقات الثانية.
نعم، please إذا بقدر أساعد بأي شيء just let me know.
أكيد في كتير أكيد ناس عندها أسئلة معينة أو مثلا مواضيع بيحبوا يسمعوا عنها أكتر، فأي اقتراحات إحنا بنرحب فيها على صفحتنا على الفيسبوك. Our show is sponsored by Dr. Abu Shanab. Dr. Abu Shanab earned his doctorate degree from National University of Health Sciences in Lombard, Illinois in 1997. He was a faculty member at the school until 2000. He earned his degree as an independent medical examiner in 2004 and his master's in advanced clinical practice in 2012. Now, Dr. Abu Shanab has two clinics, one in Bridgeview and the other in Romeoville. وبدي أفتتح موضوع حلقتنا لليوم، والموضوع رح نركز عليه هو disc herniation، وهو الفتق في العمود الفقري، الأقراص الفقرية. Even the يعني its name it sounds like painful when we say disc herniation. Doctor, my first question, please explain to us, what is disc herniation?
Well, in the beginning, Yulia, every time you do the introduction about me, again, I keep saying that you make me older and older and older.
No, really, no. If we had a camera, then the listeners will see you and they will know that you're not older and older.
Thank you. Herniated disc in general, it's actually one of the most common problem a lot of people have. A lot of people come into the office and they all say, I have a herniated disc, I have disc herniation. And you know what? The word herniation itself, it means like inflammation of the disc.
Okay.
But imagine the bones in the spine, the vertebrae in the spine are like bones, and in between them there is like a little sponge. This is the sponge. It looks like a flat cushion per se. So when this sponge is a little bit smaller, or those sponges are becoming dry, the disc in between those vertebrae become a little bit damaged. So when it damaged, it may become a little bit bulge, or it completely break out.
What is bulge?
Well, the bulge itself, imagine it like it's a hamburger right over the bun.
Okay.
It's like you can see it. It's round all the way around.
So the hamburger, like, it's bigger than the bun.
Yes,
itself.
I hope I don't make you hungry right now.
No,
But
we're okay.
but the hamburger looks like a little bit more round, bigger than the bun. So imagine the buns are the vertebra, and the hamburger, which is the disc, a little bit more distributed equally all around. This is the bulge. So it's thank God it's more common, affecting a large area, and an MRI, as I mentioned, will be looking at that. Whereas the herniation, it's actual a rupture or a crack in that disc or the sponge I was talking to you earlier. And when it's ruptured like that, it causes a protrusion of the disc material itself, which is a chemical, and that's the one that become a little bit more painful, and that's when it's really herniated. Okay. Whereas the bulging, some people have a little pain, but it's not as severe as herniated. But some others, of course, even with the bulge, but they have worse pain than herniated. So depending on the patient actual injury, the what happened to them, what causes it, sometimes age and size, of course, that all affects.
We're going to talk now about the causes, but before, I just wanted to ask again. Now, so the bulging is when you described the picture of the hamburger where the meat is bigger than the bread, right?
Correct.
This is the normal case. And when they are equal, then here we call it bulging, right? When
Uh,
they're either equal size.
no, actually, it's when it's
When
equal size, that's what's normal.
that's what's
No,
normal.
right. But the
Ah,
bulging meaning it's a little bit bigger. When the disc itself got a little bit
I see.
bulged,
Okay,
you
it
see,
became bigger.
it became bigger than the bun per se, and that's the one that's
Mm-hmm.
caused it to be painful like that. Because when it's bigger, it will affect the areas in between the muscles, the tendons, the ligaments, and that's where the pain started. But the herniation is the one that is a little bit more severe, and that's the actual rupture of 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 the disc herniation. So when you say disc herniation, you mean strictly the herniation, the protrusion. But when you say a disc, usually it's meant a bulge, which is like a small area of a problem compared to a herniation.
Okay, what causes, doctor, disc herniation?
That's really a good question. You know, very common, it's the injury. So if you sudden heavy strain or increased pressure to a lower back, that can cause, you know, the bulging or the herniation, either one. The other things that can cause it is actual activities that are done over and over and over. So let's say you are at work, you move a box that's 5 pounds only, but you move it from right to left, right to left, right to left for the 8 hours straight shift that you have. So a sudden heavy strain or sprain in the lower back that cause it, or continuous activities, that's another option. But the more common that we see, of course, is when we age, or if there is a previous injury, we have like a wear and tear of the disc. You know, we discussed this in previous episodes, which is the arthritis of the disc.
Yeah.
So as we age, our discs loses some of this fluid, or as I mentioned earlier, the fluidity of the sponge, and that become cause of the herniation because that sponge become a little bit harder. So even a cough or a sneeze, that can cause a disc herniation because you already have a prerequisites for the disc itself.
So it could happen from an injury to any age, or with age.
Correct.
Those are the basic two, let's say, causes of
Correct. Well,
disc herniation.
the way I look at it, it looks like an onion. Imagine you have a grilled onion. See, today's show should be all about food. It should be all about grilling, hamburgers and
Yeah,
onion.
and the onions.
Imagine a grilled onion, and you see the inside part of the onion, which is the bulb. So this is like the main nucleus. That's the main food and nutrition of the disc itself. And those layers of the onion, it's called the annulus, which is like all surrounding the nucleus to protect it. So if there is a pressure on one side of the onion, of course, the pressure will go to the other side, and that causes bulging or even the complete bulb of the onion to come out. So the complete rupture. So I hope this makes sense a little bit, but
Yeah.
I look at it as that. You know, if you push too hard on one side, it will push to the other side. If you push on it on the right, for example, it could be damaging the right side only, or it can go to the left side only, or it can hit both sides.
What are the ways to prevent that? Whether to move slowly, or know how to carry things, or just take rests between, especially people that have jobs such as carrying heavy weights.
Actually, all the above, like you said, those are great ways to do that. Add to it proper lifting methods, exercises, yoga, stretches, exercises before you start any heavy stuff. Like let's say you woke up this morning at 5 o'clock and your mom say, "Oh, let's go and move this couches and the stove and the oven." It's like, well, take it easy, go take a shower, relax, move things around so your muscles can move a little bit to help you to protect it.
Okay.
But that's what I meant by a sudden
No
movement.
housework in the mornings. This is the best advice, right?
Well, I don't want my kids to hear this, so
Okay.
I don't support that. But we have to be ready for this. We have to have them, you know,
Right.
get ready for it. You know, stretch it if something heavy or so.
Maybe
definitely.
special nutrition or food could help.
There is
Vitamins.
Yeah, there's a lot of stuff with it. There's a lot of studies about this as well. There is glucosamine, sulfate, and chondroitin. There is also fish oil. The sky's the limit, but the nutritional aspect of it, it needs really a huge show by itself about the nutritional aspect for the disc.
Right. Okay. Let's go back to the symptoms, doctor. Could you tell us about the symptoms of the disc herniation?
Well, depending where the disc is, let's say if it's in the neck, for example, most of the symptoms in the neck, people come in with pain, numbness, and this numbness and tingling actually starts to go down to the arm. And some people say, you know what, it goes only to my thumb, it goes only to my middle finger, or it goes to my pinky. The reason why it's more specific like that, because you are herniated, or you pinching the nerve specific to the thumb, which is, for example, C6. Then if it goes down to the arm a little bit, if it goes to the ring finger and the pinky, you're hitting, a C8 nerve. So it's depending on which nerve distribution, that's how you feel the pain and numbness and the weakness in that section. Some other people have shoulders, or chest, or arms, depending on where's the disc herniation it is, but it's the most common symptom definitely is numbness and tingling. So if it's in the neck, you'll have it in the hands and upper extremities, upper part of your body. Then if you have it in the lower back, then you have it a little bit more in the buttocks, a little bit more in the thigh, a little bit in the toes. We even have patients unable to stand on their toes or heels because that nerve distribution of the L5 or the S1 and the in the lower back being affected.
Is it related to sciatica by any chance?
Yeah, actually, sciatica, it's made of 5 nerves, and this is the one that is causes sciatic pain is from the disc herniation per se.
Okay.
This is a good point about the sciatica. You might look at patients and they are actually more tilted. You look at them and they are more going to the side, so instead of being straight, they are more tilted to one side or the other. And you ask, well, what's going on? Let's say if a patient, you look at him, or, individually, you look at him and he's tilted more to the right side, and you ask him, well, what's going on? He goes, oh, I have pain in my left lower back. So I'm staying away from it by going to the right, you see. And this is where the pinch nerve is, because if you go straight, you pinch on the left nerve and that goes down to the leg. So it's a little bit more dangerous when you have antalgia and curvature like that.
Okay.
But being that severe, we really have to be careful. Some of the symptoms, Yulia, you mentioned earlier about the sciatica, we got to be careful about, some patients even have losing urination control or foot drop, as I mentioned earlier. Those are really
Even to that extent, it can go.
Yes. So definitely we have to be careful. Being this herniated nerve doesn't stay for a long time, because the more pinching the nerve is, the worse it is, and possibly makes more damage to that nerve and whatever it's going.
Can the pain come and go, or it's just it lasts once you have disc herniation?
Well, in the beginning, it will come and go. Then after a while, it become a little bit more chronic in
Permanent,
nature.
yeah.
Yes, and this is when the other symptoms start to develop. You start going to the side, you're not straight, and you see patients actually. I don't know how they drive or do anything.
Yeah, it's better not to wait. Once anyone feel any of the symptoms that doctor mentioned, it's better just to consult the doctor right away.
Yes.
In this case. Okay, so if someone thinks that he or she has disc herniation, how do you do the diagnose?
The diagnosis, mostly it's about the history of the symptoms and physical exam. We perform neurological exams, chiropractic exam, orthopedic exam on patients. And that, depending on what the patient, indicated in his history, as I mentioned earlier, if he has numbness and tingling in the arms or legs, of course, the first thing can cause that is the disc herniation. But we also have to look into x-rays and MRIs, and sometimes the CT scans also, to further diagnose the herniation and perform a treatment plan accordingly. But when I talked earlier about some of the serious symptoms, we might have to think about even blood tests, to be the cause of to see what's the problem. Is it more a kidney infection versus a disc herniation versus a sprain and strain? So
maybe that's the first thing actually that you do, a blood test to know which one.
Well,
No.
I mean, the blood test, if we see it indicated, definitely, but very common. If it's numbness and tingling like that, depending on the patient, I would say we do a little bit more aggressive than just a blood test. If we think if it's a kidney, we can look into that. If there is a fever involved, there is anything, we can look into the blood test. But by far, the MRI and the X-rays will be the diagnosis of choice. In addition to EMGs and discography and nerve blocks might give us a better look than just a blood test only.
So you use all those methods to diagnose,
Correct.
or you choose some of them
Well,
with the patients?
depending on the patient's condition, very common we use the X-rays and the MRIs.
Mhm.
But if we see there is, the patient has a different symptoms developing, if he say there is a color in the urine or something like that, of course we'll look at the blood testing. So
Yes.
depending on the presentation.
When we talked earlier, Doctor, about disc herniation, you mentioned that there's a handful of treatments that you offer at the center. So would you tell us more, walk us through those treatments, please?
You know what? The best treatment ever is the old toilet. The big hole in the floor.
Yeah.
The squatting technique. That's the best treatment of choice
Mhm.
for herniated treatment. Actually, I'm thinking about writing a book about that because
Really?
we used squat exercises a lot for patients with herniated, for patients with bulging, and you won't believe
Huh.
the amount of improvement that they have
How
with
would
that.
that help?
Because you actually
Squat.
you flex the back, like when the
Okay.
patient goes down, and of course this is a heavy exercise.
That's
They
nice. I
can.
like squats.
Yes. So we have a specific one that we use, so please don't
Mhm.
treat yourself doing
Okay,
things
yeah.
like that.
So there's a special way to do
Special
that.
ways to do it,
Mhm.
but the sooner the better. But for the herniated lower back, for example, we do chiropractic manipulation. We do traction techniques where, if you see it sometimes on televisions or so, they put a belt around your stomach and another belt around your hips, and we just pull you. One
Mhm.
goes up, the other one goes down, just to make the herniation become
Mhm.
a little bit more pressure to take more fluid and more
Mhm.
food.
Mhm.
So traction, it will do great. The chiropractic treatment, that's really excellent. We use a lot of massage therapy, but the exercises, as I mentioned before, that's great. We use some patches, just the Leska, if you remember that
Mhm.
from overseas, of course.
Yeah.
That's an herbal methods in there. There's a lot of food in it, and we apply that for patients to go home with. So disc herniations does great with all those treatments, as well as acupuncture.
That's what I wanted to talk about as well.
Yeah.
How do acupuncture help?
The acupuncture, there's depending on the area where the nerve is. Let's
Mhm.
say if somebody have pain down the leg all the way down to the foot, we follow the nerve distribution from the back all the way down to the foot, and we
Mhm.
apply specific spots for those needles,
Mm.
and we stimulate the needles with electricity to stimulate more blood supply. And when the blood supply comes to the disc area, that will nourish with nutrition, and that decreases down the inflammation. The question is, does this work?
Does
And
this work?
well, acupuncture, it's over 3,000 years old, Julia. It's older than medicine. It's older
Mhm.
than anything, and we still use it until today. It's not like, oh,
Right.
whether it works or not. You know what? A lot of patients swear by it, and they do a great job with it, and they do excellent with it. Other methods are actual.
For a lot of patients, the acupuncture is like a ritual. They do it once in a while.
Yeah,
So.
some patients, they have it like that, but we use it a lot for diagnosis purposes,
Mhm.
for a lot of the disc herniations. It does good for necks, for people disc herniations in the neck
Mhm.
and down the arm and the legs. Um,
What about the cupping?
the cupping is excellent. We use that in combination with the acupuncture to go hand by hand. And the cupping, we don't do hujama per se. We don't X out the skin and make it
Oh,
bleed.
not that
Well, we
part.
in the state of Illinois, we are not allowed to.
Okay.
But the idea is, you. The reason why you do hujama is to increase circulation.
Mhm.
So when you apply the
And get rid
acupuncture,
of the bad blood.
okay, I hope
Blood.
there's no bad blood.
That's what they say.
Okay, I can't say that, but the idea about the cupping, you increase circulation. You get more blood supply to it, especially for people when they cough or sneeze and there's liquids in their lungs. You apply, cups in the front of their chest and cups in the back of the chest, and you really increase circulation.
Mhm.
And that's what helps a lot with the liquid in the lungs, and that decreases down the amount of cough and sneeze and the flu-like symptoms. So we took the same method and we applied it in the lower back or the neck. And you can just put a little lotion on the back, and you can move those cups all the way around, and that increase more and more. Don't worry, it's not painful, Yulia. So no, you're making faces, but
No,
uh,
I'm trying to imagine all the cupping and the acupuncture.
yeah,
It sounds painful,
yeah,
but it gives better results, definitely.
yeah.
هلا what's يعني when do we consider back pain as dangerous? When we actually need a surgery to get rid of that?
Well, you know what? This is, we call that the top eight. You know, the top eight are the ones that we look at patients differently when they come into the office. You know, if they have one of those symptoms, we should really look at it as it's a little bit more dangerous back pain issue.
Top
Or,
8.
yes, this is how I call it in my office.
Okay.
So one of them is the sudden loss of bowel of bladder control, where patients tell you, you know, I can't hold to go to the bathroom. I just let go. So this is a really, really dangerous, and that's something called cauda equina syndrome. That's completely way beyond a treatment that we can do, and that's need immediate surgery. And this is happens over the years with patients who actually wait and wait and wait, and they don't do anything, and they
And is
continue.
this related to this herniation as well?
Yes, yes, that's
Oh.
what causes. This is one of the symptoms that they lose bowel movements and bladder control. So it's very dangerous, and you know, this is quick, and hopefully we'll never see something like that.
Yeah.
The other thing that is really dangerous as well, as we mentioned earlier, is any injury causes numbness or weakness in both legs, where patients are unable to stand up anymore. They can't do things like they used to. They actually feel weakness. You know, their leg give out when they stand. So that's really another one. The third one that it's really important is persistent weakness and tingling and numbness in both legs now. Not only the one, but both legs. Like it's a constant electric stimulation in both legs. So for a long time, you know, they wake up with it, they sleep with it. That's absolutely a dangerous issue with. A fourth one, if you have a back pain, but you start to vomit,
Oh.
you know, or you have a fever involved with that.
You would never think that it's all related to back pain or disc herniation. Like, as I say, you can't control yourself. You go to the bathroom frequently, or you vomit. Just difficult to link those two issues
Correct.
together.
Well, that's why those eight are really dangerous and, you know, very serious, because, as I said, those are not something you see every day. But by the time you see them, it is a dangerous issue. If somebody have a back pain, they start to show, you know, to show there is a fever, they start to throw up. Of course, we have to look at that more. The fifth one that we have an issue with, if there is a back injury that is like due to work injury or repetition, but it's not going away. It's 2 to 3 days, and it's getting worse, worse, worse. And this is what I was talking about earlier. When you start to tilt to the side, you're unable to touch your toes, or you're unable to drive, unable to do anything. Of course, something like that, it is very dangerous. And this is the one we most commonly see, you know, especially in our area here. Most people come in, oh, I have it that for 3 months. Like 3 months? Like,
And you've been waiting all this time.
and you've been walking crooked for 3 months. I mean, you know, so the more you walk like that, crooked like that, the dangerous it is. I would say 2 to 3 days, but any more than that, it's becoming a little bit more serious. The sick thing that we have is as we talked about this as well, is if there is any kind of blood during urination, if there is any urination, you know, this is different than the first one we said earlier, where there is a complete loss of bowel. You cannot control it. This one, you can control it, but there is actually a blood in the urine. Of course, that's a little problem that we really have to look into further. Other things that we have is pain when you actually rest. Usually people have no pain when they rest, they feel better.
Yeah.
But actually he's worse when he rests versus active. If he's
Oh.
active is better with the disc herniation and numbness and tingling, but when
Really?
yes. So this is definitely need to be looked at a little bit more, and with a little bit more goggle eyes, you know, just to look into it furtherly.
Right. Those are like very important symptoms that if anyone feels that he or she has or know people, it's better to recommend and advise to go visit the doctor right away, immediately.
Yeah, and you know what? You mentioned something important. Okay, what doctor should they go?
Mm.
Okay, go to see the doctor. Well, you can't go and see,
Any doctor.
any doctor. Just mention to your family medicine if he doesn't take it serious, please take it to the next level because you don't want it to be a little bit more. But of course, neurologists, rheumatologists, chiropractors,
Mhm.
family medicine, definitely, the ones that you should look into. But if you mention to a friend or something, oh, I have that, he will not do much.
Mhm.
Let's do a little bit more serious work and do something about it as soon as you can, especially if you have numbness and tingling in the arms and legs, the chest, the neck. You should really look into it further.
Mhm. We talked earlier about sciatica. Let's talk more about it. What is it? What are the causes and the symptoms, and later the diagnosis of
All
sciatica?
that. Okay.
Yeah,
We're gonna
all
break.
that. We can talk shortly about it because we don't have much time in the show.
Okay. Well, the sciatica, it's the it's actual the عرق النسا
Mhm.
بالعربي.
Mm.
Okay. Sciatica is most of the pain comes from the buttocks that shoots down to the leg.
Mhm.
So it's any kind of pain, tingling, numbness. It's caused by the disc herniation in the back.
Mhm.
See, but the sciatic nerve, it's a big bundle. It's a huge bundle. It's made of about 5 nerves, number L4, L5, S1, S2, and S3. Those all come together and they become a sciatic nerve exiting from the buttock region, and that's the one that goes down to the leg. Um, the most common cause is the actual disc herniation, like you mentioned earlier. We talked about that before. That's the most common cause for sciatica. The other causes of sciatic pain is arthritic changes. If there is any stenosis or bone spurs, that extra bones or
Mhm.
actual pinched nerve, that is the more common to have. But we have some patients who have sciatic pain only without the disc herniation, and we have some people who have the disc herniation without the sciatic pain.
Mm.
So it's kind of sciatica. It's one of the symptoms of the disc herniation, but the sciatica, if it starts from the lower back down, it's more sciatic per se than disc herniation.
Okay.
So
Which is more serious?
oh, disc. Well, they go
This.
by because sciatica. It's more a symptom secondary to the disc herniation,
Mhm.
and it can play by itself. So it is harder to treat because it's not a joint. It's
Mhm.
not inflammation of that. It's actual nerve hidden by the muscles.
Mhm.
So it's a little bit harder to treat versus the disc
I
herniation.
hope in the coming show we will dedicate a show to talk about sciatica in the future. Doctor, before we wrap up, I would like to remind the address and phone numbers of Dr. Rashid Abu Shanab's 2 clinics, one in Bridgeview. The number is 708-599-9250. The address is 7124 83rd Street in Bridgeview, Illinois, and the second clinic is in Romeoville. The number is 815-293-3000, and the address is 600 South Weber Road, Romeoville, Illinois, and the website is drshanab.com. Thank you so much, Doctor. مني يوليا ريحاني ومن أسرة البرنامج أطيب المنى وإلى اللقاء.